Hi, everyone. Thank you for joining us. So tonight, our webinar is going to do a little bit of everything. So fun stuff beyond beauty. We're going to be focusing on wellness, weight loss, and aesthetics. I'm Kelsey. I'm one of the PAs down in the Fort Lauderdale office. So I'm going to be touching more so on the aesthetics part. And then Bree, if you want to introduce yourself.
Hi guys, I'm Bree. I work for Laser Skin and Wellness. It's in Lake Worth and Palm Beach Gardens, and I do the nutrition coaching and medical weight loss injections over here.
All right, awesome. So there is a Q&A box. So if anybody has any questions throughout, please feel free to put them in there. And then at the end, me and Bree will answer any questions you guys have. Oh, I think I'm frozen. Give me a second to try and get this going. Oh, there we go. Okay. So some goals for tonight. We're just going to be going over the combination therapy of internal and external factors, options for best outcomes with multiple modalities. The best thing is we have multiple options nowadays. So Bree will go over again her portion and I'll go over mine. That way we can get you guys best set up. So again, wellness and aesthetics are multifaceted concepts, and integrating multiple modalities to enhance both can create a more holistic and effective approach. So I'm going to touch on the aesthetic aspects. I'm going to give you guys different options. And then Bree will do the nutrition and the wellness aspect, which is getting bigger and bigger nowadays. So like I said, I work in Fort Lauderdale. Bree's up in Palm Beach Gardens and Lake Worth. So we do the weight loss down here in Fort Lauderdale. But if you guys want to take it one step further, nutrition consult, Bree is going to be your girl. She's awesome. So you guys can do a virtual visit with her if you don't live close up there. All right. So first thing I'm going to talk about is injectables. So many different options. So aesthetic injectables. So we have Botox. Botox, of course, is just a brand name. We have multiple neurotoxins. I'll talk about different ones. Dermal fillers, Sculptra, other similar treatments. And in a few minutes, I'll go over what each one is. So they're being seen as part of a broader wellness approach. So traditionally associated with cosmetic enhancements, these injectables have benefits that go beyond appearance, impacting a person's overall well-being in several ways. So this is what we offer. Again, I'm at the Fort Lauderdale location. Boca probably offers other things as well, but they do offer all of this. So neurotoxins, so that's when you're going to hear the Botox. Dysport is another popular one. Xeomin and Daxxify. So these are going to be helped to reduce the appearance of wrinkles for patients. Fillers, again, multiple different brands. You're going to hear Juvederm, Restylane, RHA, Radiesse, Versa. These are some of the popular brands, and these are going to be used to essentially replace volume that's been lost. So we lose weight, volume in our face is going to go down. So this may help a little bit with that. One thing about fillers, people always think it lifts the face, and it does not. So essentially, fillers is going to be replacing volume that's been lost, which it can give the appearance of lifting, but it is not going to be lifting, okay? Sculptra, which is actually one of my personal favorites. So it's going to be used to restore facial volume loss. It is not a filler, but it does stimulate your body's own collagen production. This is going to be great for patients who have lost a decent amount of fat in their face to restore. It's good for overall rejuvenation. Once we hit 20, we actually lose 1% of collagen. So it helps with skin quality. It's amazing. This is not going to be for the patients who want instant gratification. You are not going to see the results right away. Typically, you're going to be in our chair a couple times, about 6 weeks apart, and you're going to see the results in about 10 to 12 weeks fully. But patients do start seeing results after about a month or so. And amazing, these results can last up to 2 years, which is amazing. Kybella, PRP. Kybella is not done as often anymore. It's an injectable that's going to be used to reduce the appearance of fat. It's approved for underneath the chin. So it essentially is going to destroy and target those fat cells. A little bit longer of a recovery with that. You're going to be pretty swollen. I would say it's like a bullfrog look, and then it's going to go down. PRP, so that's going to stand for platelet-rich plasma. So it's going to use our patient's own blood. So we'll draw your blood in office. We're going to promote healing and tissue regeneration. So it can help accelerate any kind of healing. Awesome with microneedling. It reduces inflammation and improves the actual tissue regeneration. Like I said, it is really popular to do with microneedling. That is done both in our office here in Fort Lauderdale and Boca. Okay, Sculpt. So this is one of the body contouring treatments that we have here in Fort Lauderdale. So it uses both high intensity electromagnetic energy and radio frequency. So that high intensity, that's going to be helping to build the muscle. And then it also is going to use the radio frequency to reduce fat. Treat various areas. Popular ones are going to be your abdomen, the butt, inner thighs, outer thighs, front and back of the thighs, biceps, triceps, and sometimes even calves. Typically, you're going to do a series of 4 sessions. That's what we start out for patients. You can do more, but definitely don't recommend doing any less. On average, the results show about 25% more muscle and 30% fat reduction. A lot of people have heard of cool sculpting. We do have that up in our Boca office. That is going to mainly just do the fat reduction. It is not going to do the muscle. Okay, so that is the big difference between the two. So this is just kind of going over the areas that you treat. Obviously, everyone is not a good candidate for it. So we have you come into the office. We'll take a look at the areas of concern. Make sure also that you fit into the requirements of BMI, which is your body mass index. We want you to get the best out of this. Some other modalities, RF microneedling is amazing. So essentially what it's doing is it's causing little micro injuries to the skin to help stimulate the collagen and elastin production. So it's going to help tighten any kind of sagging or loose skin. A lot of patients complain about jowling. What happens is we have fat pads in our mid-face, and as we get older, lose weight, those are going to go down, and that's when you're going to start seeing that jowling, okay? Great thing with RF microneedling, minimal downtime, and you can customize the treatment, which is nice. So it's similar to traditional microneedling. The difference is the RF is able to go a little bit deeper, boosting even more collagen and elastin production. The downtime, really all you're going to see, maybe a little bit of redness, sensitivity to the skin. How we talked before about the PRP, this is an amazing thing to do, combo treatment. You can do the RF microneedling, then use your PRP. It's going to help kind of stimulate the collagen even more. It's going to even decrease the downtime, which is awesome. Good thing, modifying the treatments depending on what we're trying to do. So we can modify how deep we're even going depending on what we're targeting. If it's the loose skin texture, fine lines. So it is great. This is all at our Boca office. So again, I could go over modalities all day, but we're doing both wellness and the modalities. It is important, kind of how I talked about earlier, to do combo treatments. That is when you're going to get your best results. Bray's going to talk a little bit more, of course, on the wellness side, weight loss, but doing things together, you're going to get the best results. And again, any questions, please do put them in the Q&A box. We'll answer them at the end. All right, Bree, we'll send it over to you.
All right. So for the injectable weight loss medications that we have, we do the semaglutide and the tirzepatide. They're both medications that are going to help lower your blood sugar and support weight loss. The GLP-1, and it's a glucagon-like peptide. We naturally produce that hormone in our guts. That's what regulates your blood sugar and helps with your appetite. It's a key player in your digestion process. It helps with your satiety, which is how full you are, and the speed of your digestion. So
You need the next slide.
yeah, I
Okay.
can't click on anything. I just realized.
There you go.
Thank you. Okay, so they're a little bit different, but they essentially do the same thing. So they both suppress your appetite and they both curb your cravings. They're both taken as a once weekly injection. They're typically used for type 2 diabetes and weight management. Some people, like it says, respond better to one over the other. The semaglutide has one hormone in it that helps control the appetite and the blood sugar. The tirzepatide has two. It's a dual agonist. So it acts on both your GIP and your GLP-1s, which are the hormones that regulate your insulin and blood sugar and control your weight loss as well. So both of them are going to suppress your appetite and curb your cravings, like I said. So you're going to eat less, putting you into a calorie deficit, which results in weight loss. Next slide, please. So the side effects, they're typically all gastro-related issues. It is helping your digestion. So nausea, vomiting, diarrhea, opposite constipation. You can have stomach pain, headache, tiredness, and decreased appetite, but that one's kind of the whole goal. So with the semaglutide, you typically see more of these side effects. The tirzepatide, the main side effect that I see in patients will be really only if you eat something that you're not supposed to, that doesn't go along with the meal plan that you're given. If you do the nutrition with me or one of my coworkers, but that just kind of results in mainly loose stool, if anything. As far as patients that aren't really candidates for taking this medication, most people shouldn't have any contraindications with taking it. In rodent studies, there has been found that using these medications has caused thyroid cancer. So people with a history of that themselves or in their families, typically we steer clear of putting them on one of these medications. But for anybody with like hypo or hyperthyroidism, shouldn't be much of a problem as long as it's monitored by your doctor and cleared by them as well. So as far as nutrition going hand in hand with this medication, it's really important that you're eating properly as well while you're on it, because it's not just a magic medication and it's not just going to make you lose weight unless you're putting in the work as well. So because it suppresses your appetite and it puts you into a calorie deficit, you're going to be eating less. So you want to make sure that you're still getting all of your essential nutrients and fueling your body properly. So you want to be eating overall balanced meals and high protein. That's going to help prevent muscle loss and keep you feeling good while you're on your weight loss journey. And then as far as the B12 injections go, I love to pair those with getting these weight loss injections weekly if you can. If you are going into the office weekly for your injections, or even if you're taking them home, if you can stop in and get a B12 injection, it's great. They're really helpful because these GLP-1 medications can sometimes affect how your body absorbs certain vitamins. So having a low B12 can make you feel tired, weak, or foggy. The injections will help keep your levels up so you have good energy, supports your metabolism as well. So it's kind of a little extra boost with the weight loss. And it'll just help you feel overall better on your weight loss journey.
All right, so I'm sure you guys are the same. So like I said, we do weight loss here in our office, and then Bree, of course, as well at our sister office up at Laser Skin and Wellness. So before we start people on the medication, we typically do lab work. We're going to do a full panel, check everything out. Bree mentioned the thyroid. We're going to check your thyroid just in case you didn't know you had any issues in the past. So we're going to look at everything. We will repeat that while you're on the medication just to make sure that nothing's changed. And how Bree was kind of mentioning the B12, if you come in every week versus take home the medication. So you are given the option. We're more than happy to give you your weekly injection, or sometimes we do give people the month to go. We weigh you while you're here. So if you come in every week, we're going to weigh you every week to see. If not, we do have you weigh yourself at home just so you can kind of see how much you're losing. Bree was talking about proper nutrition. So seeing, okay, I didn't lose any weight this week. Why? What am I eating? And that's where Bree's really going to come into play here. So Bree's probably going to tell you to do a diary of what you're eating. If you're losing 0.2 pounds, but you're using this medication, why? What are you eating? Are you eating? Are you eating enough protein? So that is why Brie is awesome to do when you're doing this weight loss medication also. So you can kind of figure out making sure that you're eating everything right. We don't want you not eating anything. That's when you're going to get yourself in trouble. So going hand in hand is going to be really, really important. So using this tool that we have with Bree is awesome. Like I said, if you are in our office, Fort Lauderdale or Boca, on the weight loss medication, you do want to see Bree. Awesome. She would love to see you as well. You can go into the office with her or do a telehealth visit.
Yeah,
Okay. All right. So any questions anybody has, I'm happy to answer. Bree as well. I do also want to remind everyone in our Fort Lauderdale office, we're doing our spring fling. It's going to be on May 7th at 4 to 6. So please come in and visit us, hang out, and I will start going over. I see a couple of questions. So let's start going over them. Okay, so first one, how often should I get fillers for the volume loss? So great question. Best thing is going to come in for a consult. So we'll actually send out an email after this. So you guys can either schedule a consult online, call our office. We'll get you scheduled for that as well. Need to see you in person, how much volume loss you have, first and foremost. Are you better for filler? Are you better for Sculptra? Do you need a combination of both? I don't like doing a ton of filler at one time, so it may be done in stages. So we may do a couple syringes your first time, have you come back a month later, add a little bit then. I think it's best to do also if you are on your weight loss journey, wait till the end of your weight loss journey where you're at your goal weight so we can, not have to repeat ourselves, say in a month, 2 months, whatever, when you get to that goal weight. Fillers are different for how long they last per patient. They can last up to a year. Everyone's a little bit different, just depending on their metabolism. Okay, can I do the nutrition program if I'm vegan?
Yes, absolutely. So there's a few different ways that we tailor it to your different needs. I have an overall meal plan that I use for everybody, but I just kind of customize it to your own. My last patient that I saw today, she's vegan and she's having a lot of success on the program. So there's absolutely a way to make it work for you.
Awesome. How often do you do the semaglutide injections? I just briefly answered that earlier, but Bray.
They're weekly. So um, you use them weekly to reach the goal that you're at. And then you also have the option afterwards to do them bi-weekly, monthly, even just stop in and grab one like around the holidays or something like that for maintenance. So once you reach your goal, however long that takes, whether it's a couple weeks, a couple months, there's not really a time limit that you can be on this medication for, just whatever is working for you and whatever gets you to the goal that you want to be at. And then there's ways to maintain it moving forward. So
Okay. Can I get microneedling on my stomach? Yes, absolutely. I've done RF microneedling on people's stomach multiple times. Yeah, for weight loss, patients who are postpartum, they lose their weight afterwards, still have a little bit of sagging skin. Absolutely. You can do the microneedling on the stomach. Okay, with GLP-1 meds such as TERS, how does one combat hair shedding? It gradually lessens, but it's still a problem.
So it can be a side effect from being on one of these medications. It's mainly from the rapid weight loss. If you're losing weight really quickly, that can happen with your hair shedding. Um, that's you would want to make sure that you're really monitoring your protein intake. That's going to be probably the main thing that's going to help with that there. Obviously, if your goal is to lose weight, you want to lose weight faster, but realistically, you kind of want to slow it down a little bit to make sure that you're not having any of these adverse effects and any of these side effects from it. You can take supplements like biotin's great for that, just anything along those lines. But protein is like my main thing for being on this medication. It's definitely the most important, and it'll definitely help with that.
Yeah, and down here in our Fort Lauderdale office, we have Dr. Salzberg. She's amazing. She is a hair specialist, hair guru. We do in our office have a couple different medications that will help. So Nutrafol we have, Extrese we have. So we have options here in the office. PRP you can do on your hair as well. We have exosomes that you can put on your hair called Plated. That's amazing as well. So we do have a lot of options. So again, combination therapies of different things that we can do. And then the last question I see, how long do you stay on semaglutide? For example, a 15-pound weight loss.
So everybody's different. I don't want to say that it'll be just a few weeks or it'll take you a full year. It kind of depends on each person. I like to tell my patients that you can lose anywhere from half of a pound to 3 pounds a week on this medication. So it can be anywhere from 2.5 months of being on it to maybe 3 months to reach that goal. It's fully dependent on the person and how you comply with the program and how the medication works for you.
Yeah, and somebody who has 100 pounds to lose versus somebody who only has
So
15 pounds to lose,
probably lose
it's
it a
gonna,
lot faster in the
exactly.
beginning. Yeah.
Exactly. So it's going to definitely depend on the person. Okay, so that's all the questions I see. Like I said, please, if you guys have any questions, please reach out. I'll stay on here for a couple more minutes. And then afterwards, we are going to send out an email. If you want to schedule a consult with myself or Bree, you're able to do it on there or call our office, and we're happy to get you guys in for a complimentary consultation. All right, I'll stay on here for a few more minutes, just in case anybody has any other questions. So just to pass time for a little bit, like I said, gonna give people a couple more minutes. After losing the weight with the loose skin too, other things I talked about, the Emsculpt is an awesome option. You do lose some muscle mass when you're losing weight with these medications. It doesn't choose whether it's going for fat or muscle. It just kind of is what it is. So the Emsculpt is great because it is going to help with that muscle. And like I said, there's different places that we can use it. Our lower, our legs, so our glutes, that's going to help obviously a lot with our back, our abdomen. That's obviously where a lot of people see probably the most skin that's sagging and bothers people the most. And that's going to help build muscle. Cool sculpting. So that's going to be at the Boca office. That is going to help kill fat also. Another thing with the Emsculpt in the cool sculpting, it's not like you're going to do the treatment and the next day the fat's gone. It is going to take a little bit. Typically, you're going to see your full results about 12 weeks after the full session. So with Emsculpt, you're going to see it after doing those 4. Cool sculpting, we'll do a consult to see how many you need. Typically, somebody may need a couple sessions. Same thing. You're going to see your full results about 12 weeks after. Emsculpt, you're going to do everything about a week apart. You can do it as soon as 3 days, as long as 10 days, but you are going to do those 4 treatments. Ideally, it's going to be back to back. It's not going to be like one this month and then again in 5 months. We want everything to hopefully be at that same time, kind of weekly. So, all right. I don't see, let me see. What's the cost of semaglutide? So, you want to see what it is at your office?
At our office, we have a couple of options. So there's 4-week programs, there's 6-week programs. Everything ranges from $450 to $900, depending on the program. So that's kind of just what we do here. And you have the option also to purchase individual injections, which range from $150 to $200.
Okay, for like the weekly?
Yeah, that would be
Okay.
weekly. And then the programs are 450 for a 4 week program of semaglutide, um, and 700 for a 6 week program. And then the tirzepatide is a little bit more expensive.
Do you guys include B12 at your office with yours, or is it
We do.
separate?
We do.
Okay.
It comes with a McB injection every single week that you come in for
So,
your GLP-1.
okay, awesome. Yeah, and then I know we do, if somebody's not on the program, but they want a B12 injection, we charge 25 per injection here for that. So
Us too.
you have options.
Mhm.
You guys do the same price?
Yeah, same thing. It's
Okay.
25.
Okay, perfect. All right, I don't see any more questions, so I think we are gonna wrap it up. Hopefully we'll see you guys all at the Spring Fling in May. And like I said, we'll send out an email if anyone wants to do a complimentary consult. We will be happy to see you guys.